Hello students, welcome to EPG Pathshala. I am Dr. Sandeep Walia, Head of the Department, University Institute of Tourism and Hospitality Management, Chandigarh University. Today we are going to discuss the module Impact of Air Travel on Human Health, Meaning and Concepts under the paper Aviation Industry, Ticketing and Frontier Formalities. After completing this module, the students will be able to understand the meaning and concept of air travel and its impact on the human health. They will also understand the environment of flight, atmospheric pressure, oxygen level, reduced temperature, quality of air in the cabins. They will also know about the various commercial flight health effects on the human health. They will also understand about hypoxia, deep vein thrombosis, jet lag, motion sickness, etc. They will also be aware about the impact of air travel on passengers with diseases. The students will also be aware about the pulmonary condition, neuropsychiatric conditions, cardiovascular diseases, and they will also be aware about the health events on board and emergency medical kits and their procedures. The students will also know about health risks of air travel and aviation safety hazards. They will also understand about hidden health risks and social consequences, physiological impacts, psychological and emotional impacts. The students will also know about other hazards like lift-off, economy class syndrome, hearing loss and cosmic rays effect on human body. They will also be aware about how to get better flying experience and overcome such effects. Dear students, traveling through air is the fastest mode of transportation to get to any destination within a short span of time. People from every class prefer to travel through air so as to save their time and cover far distances in a shorter time. According to International Air Transport Association, every year 36 billion passengers travel through air, and this trend is increasing day by day. The passengers during their flight are exposed to various physical as well as mental stresses. Some of them, which are very common, includes reduced oxygen level, atmospheric pressure, noise, cosmic rays, poor air quality in cabin and vibrations. These stresses results in health hazards, diseases like deep vein thrombosis, commonly called as DVT, which occurs due to prolonged sitting and most common when traveling in economy class. Besides this, cardiovascular diseases, jet lag, motion sicknesses, travel fatigue are also common health hazard problems which can occur during air travel. Dengue, malaria, tuberculosis and influenza are other common diseases which can spread due to transmission even through mosquitoes, insects, animals and other passengers. Generally, most of passengers travel in flight without knowing the health hazards issues of air travel. Most of the diseases occur due to lack of regular sleep, prolonged sitting in vertical posture, etc. The present module shall discuss about the effect of air travel on human health. The module shall also discuss about the various health related diseases which can occur to human beings while traveling through air. Let us first discuss the environment of flight and impact on human health. Generally, airline environment is not healthy for passengers as flight operators operates flight at a high altitude of 10,000 feet to 50,000 feet normally and can result in the following conditions. Reduced atmosphere pressure. As we reach heights, atmospheric pressure continues to fall and results in expansion of gas which affects lungs, intestine, etc. The next one is the reduced oxygen level. As the airplane attains the height, the atmospheric pressure and oxygen level get reduced and which can result into hypoxia. The next one is the reduced temperature. Pressurized cabin are there in airplane in order to prevent hypoxia. As plane attains heights, the temperature gets reduced. Let us now discuss about the environment of cabin. Outside air is compressed by jet engines in order to maintain the required pressure level in the cabin. The proper air ventilation in the cabin is required so as to prevent pollutants and to give passengers a comfortable and safe flight experience. Quality of air in cabins. The quality of the air in the cabin is the most debated issue among passengers. Air quality affects due to smoke, dry and stuffy air and reduced temperature. To maintain the quality of air in the cabin, pressurized air is passed in the cabin with the help of jet engines. High efficiency particulates filters, that is HEPA, is there to prevent particles like hydrocarbons. Most airlines don't allow smoking in the aircraft, but several incidents are there where smoke, vapors and fumes enter in the cabin, thereby resulting in reduced air quality and become a source of irritation to the passengers. Other things that can affect air quality in cabin are perfumes, pesticides, cleaning agents, food and beverage products, paints and chemicals, etc. Let us take the commercial flight health effects. Stress occurs before flight departure. The airports always have to be busy environment. The passengers have to be in the long waited queues for check-in and security check procedures. The passengers, because of these lengthy and hectic procedures, gets stressed, irritated, uncomfortable and tired, which results in causing mental and physical stress to them. Hypoxia. The air is too thin to breathe at the height of 10,000 meters above sea level, so the cabins are properly pressurized. The ventilation is done in order to maintain air quality inside the cabins, but still the oxygen level is reduced inside the cabin and passengers can breathe the less amount of oxygen as they can breathe at the ground. It results into the drop of oxygen level in the human blood up to 5%. The exterior oxygen is added during the flights, but that is not enough as to maintain the original oxygen level in the human blood. This causes altitude sickness due to reduced atmospheric pressure. The lower oxygen level in the blood results in headache, nausea, stomach bloating, vision impairment, fatigue and lack of concentration. People suffered from cardiovascular disease need to take advice from the doctor before traveling through air, because reduced oxygen level is the major cause of heart attack and in the long haul flight situations can be worse. The next one is the deep vein thrombosis or the cramped conditions. It is caused due to prolonged sitting. It is mostly reported and found in economic class passengers, but business and first class passengers also suffered from DVT. It is more commonly found in people who used to smoke and are suffering from illness and other medications. It results in blood disorders like clotting of blood. The cardiovascular diseases affects pregnancy, increased blood viscosity, obesity, etc. DVT is at peak if someone is traveling for more than 8 hours, and if passenger is suffering from cancer, then the risk of having DVT is almost get doubled. Things to consider to prevent cramped condition. There are so many things which should be taken care of. Reduce the consumption of alcohol and caffeine products. One should drink ample amount of water. The passengers should hydrate their skin and lips as well. One should not sit long and walk around and stretch his legs. Do muscle exercise during the flight. The next one is the jet lag or the circadian dysthymia. Circadian dysthymia affects many physiological functions based on 24-hour cycle. It also occurs due to lack of regular sleep, prolonged sitting, which results in fatigued body and jet lag. The next one is the motion sickness. Aircraft changes position while flying due to number of factors. During this time, the passenger's vestibular system stimulates. The vision stimulation occurs that results in nausea, vomiting, stomach disorders, etc. The best way to prevent the motion sickness is to use the headrest and closing of eyes to stop continuous movement of the eyes. Let us now discuss the impact of air travel on passengers with diseases. Dear students, the passengers on their health while traveling through air can observe the following effects. These effects are as follows. The first one is pulmonary conditions. Passengers with hypoxia, bronchial asthma and chronic obstructive pulmonary disease required taking proper medication when supposed to travel by air. Neuropsychiatric conditions. Passengers with severe neuropsychiatric conditions must avoid flights because it can lead to aggressive behavior, which results in stress provoke. Oxygen support is very necessary for such kind of passengers. The next one is the cardiovascular diseases. Flights are unsuitable for the passengers who have recently gone through a bypass surgery, unstable heart failure and coronary artery diseases. Air travel can affect their blood circulation and respiration. The next one is the health events on board. Every year number of passengers has been reported suffering from travel diseases, and even number of deaths occur during the course of the flight. To prevent such casualties, emergency medical kits have been placed there in every flight, and maximum standards or minimum standards are there for medical kits made by Federal Aviation Administration. Emergency medical kit on board. Federal Aviation Administration. Medical kit must include blood pressure, cuff wipes which will be antiseptic, a stethoscope, gloves which will be sterile, needle and syringes and nitroglycerin, etc. Now most of the airlines provide doctor availability to the cockpit during 24 hours. The next one is the environmental impact of flight. The first is the noise. It is the unacceptable sound of jet engine which results in disrupting sleep, frightened children. It also affects human health, caused decreased quality of life and affects blood pressure. The next one is ozone. Depletion of ozone occurs due to aircraft flying above 50,000 feet. Dear students, let us now discuss health risks of air travel. Some of the risks which are associated with air travel are discussed as follows. The first one is dehydration. This is reported common to the passengers traveling through air. Passengers should drink more water during air travel. Better to take more fruits, vegetables to prevent from dehydration. Lung damage. Air is not completely purified in the cabin and contains fumes, smokes, etc. with it. However, air ventilation and purifiers are there in the aircraft. Still, it does not give passengers pollution-free air, and which can result into lung damage as well. Bedbugs. Bedbugs and leaves can be there on the aircraft seats, blankets and headrests. As number of people travels and seated on the same seat, infection rate is very much higher. A plane takes 2 to 4 flights in one day. It is better to spray peppermint or tea tree oil on passengers' seats to reduce the risk of fleas and the bed bugs. The next one is the increased cancer risk. Long trips on air travel affects body clock and hormone level. They also affect chemical imbalances which results in tumor growth. Passengers and crew are also exposed to radiations on the high altitude while traveling through air. The next one is deep vein thrombosis, commonly called as DVT. Deep vein thrombosis is most commonly occurring in obese and elderly people. The reason of occurrence of DVT in air travelers is because of that they are packed into their seats like sardines. Due to vertical position of passenger during flight, the proper blood circulation may be affected. Better is to walk and move around to prevent the DVT during the flight. For better flying experience. Dear students, for better flying experiences and enjoyable flights, the passengers must take following things into their consideration. The first is to eat little. The passengers must take their meal well in advance before boarding the plane. Better to eat more vegetables, fruits and water than carbonated drinks and junk food. The passengers must choose tea over coffee because coffee contains caffeine. They should drink ample amount of water. The passengers must drink or intake a lot of water in order to prevent dehydration. It's better to hydrate the skin by water, spray on the face or by essential oils. The next one is better to plan trip in advance. The passengers are advised to plan their trip well in advance. They should more emphasize on what they need, the necessary items during the flight, the food and other things required during journey, and must follow proper sleeping schedule. Blood oxygen drops. Lower oxygen level leads to fatigue and passenger feel sleepy. Blood circulation is not done properly, therefore the passengers need to extend their legs to circulate blood properly in their body. Dear students, let us now discuss about the other hazards of air travel. Some other hazards which have been reported during the air travel includes the following. The first one is liftoff. Full body scans either through X-rays, flashlight as well as low energy radio waves affects frequent air travelers and cabin crew staff, which results in cancer and cardiovascular diseases, vision and hearing loss and mental disorders. Second one is disease. Low humidity in flight leads to get a cold or a nausea. The next one is the economy class syndrome. A pulmonary embolism is occurring while the passenger sits for a long time. It also creates uncomfortable nuisance, even can kill the passengers by causing blood clots formation. Deep vein thrombosis is also an economy class syndrome. Passengers can prevent it by wearing loose clothing, drinking lot of water, stretching and walking. The next one is the hearing loss. As the passengers fly more is the risk of hearing loss. According to National Institute for Occupational Safety and Health (NIOSH), safety limit is 88 decibels for 4 hours flight and 85 decibels for 8 hours of flight. Passengers sitting in the back seat have more chances of hearing loss. The best option is to use noise reducing headphones. They can cut noise up to 40 decibels. The next one is the cosmic rays. As the passenger fly more and the more they are near to the North Pole, they are exposed to the cosmic rays. These are energetic particles from space and can cause even cancer. Then the hidden health risks and social consequences. Frequent passengers who travel a lot because of businesses or meetings or other works, air travel is the most comfortable and time-saving mode for them, but it also involves some hidden health risks associated with the air travel. Some of them are discussed here ahead. Physiological impact. Prolonged sitting and vertical posture of body prevent proper blood circulation and results in deep vein thrombosis. Jet lag occurs due to body clock, long haul flight and results into disruption of body's circadian rhythms. It can cause fatigue and gastrointestinal problems, also affect the immune system. It increases the risk of stroke and heart attacks and can also cause cognitive deficits like memory impairment, etc. High amount of radiation exposure is also there for frequent flyers and cabin crew members, which results in cancer-causing problems. Above all are the physiological impacts of flight. The next one is the physiological and emotional impacts. Stress is the main physiological impact due to long queue airport operations. That is for check-in procedure, baggage handling or security check, etc. Besides that, business passengers has workload stress. Flight delays result into fatigue and increased anxiety factor in passengers. Social gathering and family time is also affected by the regular and excessive air travel. Children also become irritated when their parents used to be more on travel and away from home. Frequent travel results in imbalance in domestic, social involvement and children care. Burden on women increases due to busy trips of men, resulting in weakening friendship and social network. So a negative impact is there as a frequent air traveler, which makes passenger irritated, restless, angry and aggressive. The next is aviation safety hazards. Aviation safety is of utmost importance. Number of items may be left in the aircraft during repair or manufacturing parts and sometimes on the runway even, which can cause major airplane crashes. It comes under foreign object debris. For example, number of people died in Air France flight 4590 due to crashing of plane by hitting with the part that is fallen from another aircraft. The second is lack of information. Lack of information leads to accidents. For example, a pilot can be misinformed by a printed document that can be a manual or can be a map. The third one is snow and ice. Snow and ice are the major cause of accidents. Adequate lift of the plane is not possible even with a small amount of frost or icing on the airplane wings. Airports and aircrafts are regularly de-iced before takeoff. Modern aircrafts are designed to prevent ice buildup on wings, engine and tails by heated air from jet engines. For example, as a result of ice or snow on aircraft wings, Air Florida Flight 90 crashed in 1982. The next one is the engine failure. Due to fuel starvation, the engine fails to function. Poor maintenance of aircraft leads to mechanical failure. Sometimes emergency landing is not possible, which leads to aircraft crashing. For example, Aloha Airline Flight 243 met with accident due to lack of fuel, and a number of passengers died in this crash. The next one is the fire. Automated fire systems are installed in the airplanes for safety and security of passengers in the aircraft from fire. Number of fire accidents have been reported in aircrafts. Most of fire accidents occur due to short circuit and dripping of water on wire loads. For example, 110 people died on board in ValueJet flight 592 due to fire in baggage holds. The next is the bird strike. Cockpit windshields can be shattered because of bird strikes, and accidents can be caused by engine failure due to birds. The next is the pilot error or the improper communication. It is the most common factor in the collision of aircraft. International Civil Aviation Organization defines the physiological state of reduced mental and physical performance capability due to lack of sleep, busy routine workload, etc. Then the ground damage due to dent in the airplane, scratches can also result in major accidents. The proper care aircraft is taken and plane is inspected before flight takeoff to prevent such accidents. Volcanoes. Near active volcanoes, airplane propellers, engines, cockpit windows can be damaged, which results into the accidents. The next one is the runway safety. Inappropriate exit of flight from runway can also lead to aircraft accident. The next one is terrorism. Hijack situation are most severe issues for aircraft and passenger safety and security. Aircrew staff is specially trained to deal with such kinds of situations. Proper security check is done in order to prevent from hijack related problems. Dear students, let us now summarize what we have discussed in this module. For number of passengers, air travel is the way of life. To meet the commitments of employment, passengers need to travel regularly. Air travel is the most easy, comfortable and time-saving mode of travel, but there are a number of health hazards or issues that occurs because of air travel, like DVT, which is also known as economy class syndrome. It occurs due to prolonged sitting. Hypoxia is other hazardous disease occur because of reduced oxygen level as the plane reaches height, atmospheric pressure drops and oxygen level decreases. So patients with cardiovascular diseases, bypass surgery should not travel in airplane for long haul journeys and must take doctor's advice before undertaking any travel. Jet lag is also a common disorder of air travel and it occurs because of traveling in multiple time zones. It can also occur because of irregular sleep and results in fatigued body, irritation, motion sickness. A number of diseases can occur due to the continuous movements of people in the plane. It creates nausea, cold sweats, vomiting and stomach bloating. To avoid it, better to use headrest with closed eyes. These are the major impacts of air travel on the human health. Passengers' fatigue is common in air travel caused by disruption of regular routine and disappears after taking proper rest or sleep. Other health hazardous diseases are dengue, malaria, tuberculosis, which occurs due to transmission of disease through mosquitoes, animals and other passengers in the aircraft. Though air travel is the most luxurious way of transportation, yet associated with many of the aspects which can trouble human life or even can result into the loss of the human life. The irony of the industry is that the aviation industry is yet to take the major remedial steps in the field of human health and safety during the flight. With these words, I sum up this module. Thank you.